Assalamualaikum and hello everyone. My name is EIRYEEN Nathasya binti Nazri. Today I will be presenting on my case presentation. So in this presentation today, I will begin with my description of counselling site, which is SMK Setapak Indah. SMK SI is National Secondary School located in Jalan Setapak, Kuala Lumpur. There are 78 teachers, 3 counsellors and 1019 students. Basically, the case category that I will present today is intrapersonal, which is the client have a negative thoughts about oneself and low self-esteem, and this type of category is preventive since the client need to be assist to overcome her insecurities. Cognitive behavioral therapy. CBT is the merging of behavioral and cognitive therapies that working with the client in the present. So CBT is a theory that focusing on the cognitive process that produce feelings. So the approach helps by changing people's behavior and attitude with a deeper understanding of thoughts, image, belief, and attitudes. Cognitive behavioral therapy also can be effectively used as a short-term treatment centered on helping people with a very specific problem and teaching them to focus on present thoughts and belief. During the counselling session, I have been used cognitive behavioral therapy in most of the cases such as family issues, anxiety, depression, difficulty in sleeps, and et. So CBT manage problem that change the way client thinks and behave. Next, CBT believes the psychological problem as having 3 components, which is the cognitive system, reflects what the person thinks and how the person process the information. Second, the emotional system, which reflect how the person feels, and the behavioral system reflect what the person does. Next, I will continue on demographic description of client. EE0522F is a Form 3 student of SMK Setapak Indah. She is a Malay Muslim aged 15 years old. She lives with her parents at Taman Setapak Indah. The client is one of the best students in Form 3. Her parents are married and live together happily. She is the eldest from 2 siblings. The client also has a good relationship with her parents. Her parents work at the same company, which her father as a driver van, while her mother as a clerk. She comes from the middle class of socio-economic status. She voluntarily comes to the counselling session as she needs someone to talk with. She mentioned that she never opened up with parents about her problem as well as her feelings whenever she needs before. So she decided to meet the counsellor to share about her concern. So this is the client's biopsychosocial history. First, we will be looking at the history of her presenting problem, which is this client approached the counsellor because she felt stressed with her academic since she can't catch up very well in her classes before, as she feels mentally and physically exhausted. But now she felt better because it's already face-to-face class. There is too much workload that need to be done by her. After a few sessions, she just disclosed her problem, which is she's lack of self-confidence, self-esteem, and negative thoughts that always disturb her every time she needs to go to school. His family history, social relationship, and academic performance has been explained previously. As for the medical history, the client has asthma and have no addiction. According to her counselling history, she had never attended any counselling service before. Lastly, her cultural specific is Malay Muslim. This is the presenting issue of my client. She is a self-referred client because she voluntarily seek for counselling service. EE0522F approached me to be my client as she needs someone to talk to, which can be trust. In the second session, client stated that she feels stressed and does not like learning in her classroom. She mentioned that the homework given by the teacher also sometimes can burden her since she needs a lot of time to complete it. However, she able to do it. In the third session, she disclosed that she already feels safe to share with the counsellor. She stated that she have a low self-esteem and negative thoughts about herself. It began when her friends always mocked her and called her as gegasi. 6 session has been done with this client, and the session would conducted in individual session room in SMK Setapak Indah. For the treatment plan, I have arranged it according to these 5 elements, which are assessment of the case, issues identified, treatment goals, summary of the session, and the treatment intervention. I will explain further about all of this. For this client, I had done some observation to observe her cognitive, emotional and behavioral patterns. What can I see from the cognitive perspective? At first, client has a negative thought on herself. She always thought that she is not beautiful, she has a bad appearance and she feels bad about herself. Next, looking at her emotional pattern, client always feels sad and will cry. Sometimes she felt very angry. She felt down and ashamed to expose herself. After being through a few sessions, I can see changes in her emotion. Lastly, her behavior. The client will always isolate herself in the room and vent her feelings of anger at her little sister. She also tried to be independent by finding more effective action together with the counselor. The issues that can be identified from the client after conducting a few sessions with her. The client have negative thoughts about herself and always made criticism about herself, which leads to persistent feelings of sadness, anger, shame and feels down. It also influences client's behavior where the client will stay at her room and will angry to her little sister for no reason. Since before this she had having online class, her friends never mock at her again. But after the face-to-face classes started, she always have a negative thinking where her friends will keep mocking on her. The client also have a low self-esteem. She always feels unhappy and unsatisfied with herself. The client felt embraced to meet people, socialize, and to expose herself outside even social media. The client feels that this problem limits herself from doing anything that she wants since she is the top student. Next, I will share about my treatment goals in these sessions. I had come up with 2 goals that is mutually developed with my client. The first goal is to change client negative thought about herself and replace it with the positive thoughts. This is because the client have negative thoughts and always make criticism on herself. The second one is to increase self-esteem by improving client self-acceptance. This is because when the client have low self-esteem, it will limit herself to do other things that she wants. So moving on the summary of the sessions, I have conducted 6 sessions. So this is the summary of first until third sessions. Next, this is the 4th session until 6th session. Then I terminate the session after there has no unfinished business left. Plus, the client also clarified that she already has the courage to handle this problem by her own. Next, I will explain further on the illustration of each intervention that I did. The first one is related to CBT, which is ABC Functional Analysis. I gave the ABC worksheet to the client and discussed on it together to learn about herself. For this intervention, we managed to discover to target which consequences we want to change and then work backward to identify the rest of the behavioral chain to determine the causes of the behavior. For this case, the client knows she has too much insecurities that bothering her. Next, I will explain further on the illustration of each intervention that I did. The first one is related to CBT, which is ABC Functional Analysis. I gave the ABC worksheet to the client and discussed on it together to learn about herself. For this intervention, we managed to discover to target which consequences we want to change and then work backward to identify the rest of the behavioral chain to determine the causes of the behavior. For this case, the client knows she has too much insecurities that bothering her. For the second intervention, we aim to change client negative thought about herself and replace it with the helpful response. To make it successfully, we did 2 activities, which are tracking negative thoughts and cognitive restructuring. For the second activity is tracking negative thought. Tracking negative thought might help the client become fully aware on the negative thoughts that she have. During the activity, the counselor asked the client to list down all of her negative thoughts in a piece of paper. From what the client have wrote, most of it was a criticism about herself. Then, counselor will deep explore the thoughts that have been wrote in a paper. Next, For the third activity, which is cognitive restructuring, this activity refers to the process of replacing cognitive distortion with thoughts that are more accurate and useful. So after the client have identifying the negative thought of belief, the counselor evaluate the accuracy of client's negative thinking by questioning and challenging her thoughts. So, the counselor will guide the client to reframe her negative thought with more accurate thoughts and help the client to come out with the helpful statement that she can say to herself. The counselor, with the agreement of the client, also gives some homework to the client to read a helpful statement 3 times a day. So here are some of the helpful response that can help the client. For the second intervention, we are focusing on low self-esteem issue in order to increase self-esteem by improving client self-acceptance. There are 2 activities that have been done with the client, which are my biggest strengths and self-esteem journal. So for this activity, counselor need to identify and reflecting on client's core strengths as a person which can help the client make some change in her life. So the counselor will work with the client to identify the strength that she has. Then counselor will ask the client to reflect about their friends, family, peers and teachers would say about her, which may help her to find out her strength that she never noticed before. So by using this activity, the client will boost her confidence and her self-esteem slowly. So for the next activity is self-esteem journal. Journaling can help the client to improve feelings of well-being and increase her self-esteem. So at the end of the counseling session, the counselor recommends to the client to do self-esteem journal, which is will help her in improving self-esteem. The counselor also ask the client to record her 3 daily statements related to their success, good qualities and positive experience to help her to increase their self-esteem. So the counselor also remind the client to do this self-esteem journal in order to help her after this counseling session have been terminated. So moving on to the next part, which is the case termination. I have terminated the session with the consent of my client as she has achieved her goals in this session. I also gave her the evaluation form to evaluate the whole session. As for the evaluation part, I had evaluated in 2 categories, which are the client's progress and my personal reflection. The client is aware that her negative thought influencing her emotion and behavior. So after the session, counselor noticed that the client also aware that she has lack of self-esteem can give adverse effects on her life. The client also give full cooperation throughout counseling session, and also the client is very committed in making change for herself. So progress observed, the client slowly modify her negative thoughts and the client also show a positive improvement in order to build her self-esteem. Next, counseling professional assistant. Counselor help the client to change the thinking even though it took some times, and also counselor ask the client to do self-esteem journaling in order to help her to cope with her lack of self-esteem. So for the counselor personal and professional reflection, I learned a lot of things from this session because it is my first experience working in school settings since I'm doing online session before this. Then this is my first time using cognitive restructuring as an intervention. However, there are a few limitations that I need to handle. Firstly, I cannot easily access clients' body language information. Also, it's difficult for me to take care the confidentiality and privacy. Last but not least, for the self-observation, the counselor need to gain more knowledge on counselling intervention as well as counselling skill, and the counselor need to improve the use of counselling skills during the session to make it more effective. So in conclusion, choosing a suitable and appropriate intervention is important in a counselling session. I believe the intervention that I used throughout the session are really help the client to overcome her issue. Setting up treatment goal with the client allows both counselor and client to see the progress throughout the session. So I'm glad that the goals achieved together with the client. So here are the appendix for the session, and here are the reference. So that's all from me. Thank you for your attention. Bye bye.